Neurologist explains, if your nails look like this after 60, your body can be hiding 4 diseases. Your body is a complex and finely tuned machine, constantly providing subtle cues about its inner workings, if only we knew how to interpret them. Among the myriad signals it sends, some of the most overlooked yet profoundly insightful can be found right at your fingertips, your fingernails. Take a moment right now, wherever you are, to observe them closely. Press down firmly on one of your fingernails for approximately 2 seconds. Then release the pressure. Observe with attentiveness how swiftly the natural, healthy color returns to the nail bed. This simple, entirely equipment-free maneuver is not merely a curious trick. It is a fundamental assessment technique utilized by cardiologists worldwide to gauge circulation efficiency in mere seconds. The profound insights this quick capillary refill test offers, combined with 3 other distinctly visible nail signs, unveil crucial information that a significant majority of adults, particularly those over the age of 60, often remain unaware of. Your nails, in their silent and unassuming growth, function as a continuous biological ledger, meticulously recording the daily narrative of your heart's performance and the intricate health of your vast network of blood vessels. The core challenge lies in the fact that this invaluable visual language of the nails is rarely taught or understood by the general public. As individuals progress beyond the age of 60, a critical period unfolds where cardiovascular problems, often insidious in their development, tend to emerge without overt or dramatic symptoms. These silent conditions can advance unnoticed until a severe, often life-threatening event suddenly materializes. In this context, the subtle alterations that appear on your nails transform into one of the most accessible and non-invasive early warning systems available, requiring no hospital visit or specialized medical apparatus for initial observation. Dr. Ben Walker, drawing from over 2 decades dedicated to the field of preventative health for adults in their senior years, aims to illuminate 4 specific nail signs. These signs, through extensive medical research and clinical observation, have been definitively linked to an elevated risk of critical cardiovascular events, including heart attacks, strokes, and debilitating circulation problems. While all 4 signs hold significant importance, the 4th one, in particular, carries a unique weight and is one Dr. Walker most urgently encourages you to recognize before the conclusion of this discussion. It is a sign that can be assessed in a mere 3 seconds, and the revelations it often provides leave most people genuinely astonished. Before delving into the specifics of these vital indicators, it is beneficial to consider your own personal context. If you are inclined, share your current age in the comments section and indicate whether any members of your immediate or extended family have experienced a heart attack or a stroke. Your response to these questions can provide a valuable framework for understanding the personal relevance and urgency with which you should approach the information about to be presented. Should you find this kind of health content genuinely valuable and illuminating, a quick click of the like button offers invaluable support, enabling continued efforts to produce and disseminate such crucial knowledge. To fully grasp the profound significance of these 4 nail signs, especially as one navigates the health landscape after the age of 60, it is essential to first understand the underlying biological mechanisms governing nail growth and health. Your nails originate from a specialized anatomical structure known as the nail matrix. This vital layer of living cells, situated just beneath the very base of each nail, is in constant and intimate contact with your bloodstream. Consequently, these cells are acutely responsive to even subtle fluctuations in systemic oxygen levels, the overall quality and efficiency of circulation, and the intrinsic health of the body's most diminutive blood vessels. The intricate network of capillaries nestled beneath your nail bed represents some of the smallest and most delicate blood vessels within the human circulatory system. Their minute size renders them remarkably sensitive, often making them the very first physiological structures to display tangible signs of distress or impending trouble when the broader cardiovascular system begins to encounter challenges. For an individual in their 30s, the heart and its associated blood vessels typically possess enormous physiological reserves and adaptive capacities. This robust resilience allows the body to effectively mask early-stage dysfunction or emerging issues for extended periods, often without any discernible indicators appearing on the nails. However, as individuals transition past the age of 60, these once ample reserves gradually diminish. This reduction is not indicative of a broken body, but rather reflects 6 decades of continuous, efficient operation, during which the margin for silent, uncompensated dysfunction becomes notably thinner. Consequently, the nail bed can be conceptualized as a transparent window, offering an unobstructed view into the state of the smallest and most vulnerable blood vessels throughout your entire body. When these microvessels begin to struggle or falter, the nails frequently serve as the initial site where this internal struggle becomes outwardly manifest and visually perceptible. It is worth noting that during a typical 15-minute medical appointment, your primary care physician is not routinely examining your nails in exhaustive detail. The time constraints of modern clinical practice dictate that only a limited amount of ground can be covered, and unless a nail anomaly presents as overtly alarming or is specifically brought to the doctor's attention, a comprehensive nail examination rarely ascends to the top of the priority list. Thus, while this invaluable diagnostic information is well documented within specialized medical literature, it does not consistently bridge the gap from the clinical research setting to the individual who stands to benefit most from its awareness. Let us now embark on a detailed exploration of these 4 critical signs, one by one, with a particular emphasis on the 4th sign, as it remains largely unrecognized by the vast majority. The first crucial sign to observe is a distinctive color change referred to as cyanosis. Within this phenomenon, there exists an important and often unappreciated distinction that most people have never been educated about, and understanding it profoundly alters the urgency with which one should respond to such an observation. Broadly speaking, cyanosis describes a bluish or purplish tint that becomes visible through the nail bed, frequently more pronounced near the base of the nail. However, the manifestation of cyanosis can occur in 2 fundamentally different forms, each carrying very distinct clinical implications. The first type is designated as peripheral cyanosis. This condition is characterized by the bluish discoloration appearing exclusively on your fingernails and potentially your toenails. Crucially, in cases of peripheral cyanosis, other key areas such as your lips, tongue, and the mucosal lining inside your mouth retain their normal, healthy pink coloration. Peripheral cyanosis typically develops in a gradual manner, often unfolding over a period of weeks or even months. It acts as a subtle yet significant message from your body, indicating that the circulatory supply to your extremities, your hands and feet, is not as robust or efficient as it once was. While it serves as a definite warning sign, alerting you to a potential underlying issue, it is generally not considered an immediate medical emergency. In stark contrast, the second type is termed central cyanosis, and its implications are far more serious. With central cyanosis, the telltale bluish discoloration is not confined solely to your nails. It extends visibly to your lips, your tongue, and the interior tissues of your mouth. The presence of central cyanosis demands immediate medical attention, as it signifies a critical systemic problem. The blood being pumped out from your heart is dangerously deficient in oxygen. This situation constitutes a genuine medical emergency, requiring urgent intervention. From a biological perspective, in both forms of cyanosis, the underlying issue is that the blood reaching the affected tissues is not adequately oxygenated. In peripheral cyanosis, the primary pathology usually resides within the localized circulatory system, often indicating reduced blood flow to the extremities. Conversely, in central cyanosis, the problem is typically a more systemic failure of oxygenation, frequently originating from significant issues within the heart or the lungs themselves. Extensive medical research has established robust associations between persistent peripheral nail bed cyanosis and a spectrum of serious health conditions, conditions. These include early-stage heart failure, certain heart valve problems that may have remained undiagnosed for decades, and chronic lung diseases that, over time, place an increasing and ultimately unsustainable strain on the heart. The profound relevance of this observation for individuals over the age of 60 cannot be overstated. The prevalence of heart failure rises sharply with advancing age, making it one of the most frequently underdiagnosed and yet potentially debilitating conditions within the older adult population. Critically, early-stage heart failure often presents without any dramatic or easily recognizable symptoms. There is no sudden, crushing chest pain. There is no abrupt collapse. Instead, what occurs is a gradual, quiet decline in the efficiency with which the heart is pumping blood, a process that the body initially compensates for with remarkable adaptability. This compensatory mechanism continues until the body's reserves are ultimately exhausted, at which point more severe symptoms may suddenly manifest. Consider the illustrative composite patient story of Frank, a retired postal worker from the sunny environs of Sarasota, Florida. For nearly a year, Frank had intermittently noticed a slight purplish tint at the base of his nails, particularly pronounced in the mornings or after prolonged periods of sitting still. He, like many, attributed these observations to seemingly benign factors: the occasional chill of cold weather, a general sense of poor circulation that he simply presumed was an inevitable consequence of aging, and his lifelong tendency to run cold. It was only when his daughter, visiting from out of state, made a casual but pointed comment about the unusual color of his nails that Frank finally decided to mention it during his next routine checkup. His attentive doctor, taking the observation seriously, performed a thorough examination and subsequently ordered an echocardiogram, a specialized ultrasound of the heart. The results revealed early-stage heart failure, a condition that, thankfully, was still highly manageable through the appropriate combination of medication and targeted lifestyle adjustments. Frank's proactive disclosure, spurred by his daughter's observation, very likely averted a major hospitalization that almost certainly would have occurred within the subsequent year, highlighting the critical value of early detection. The practical and actionable takeaway from this discussion of cyanosis is unequivocally straightforward. Make it a regular practice to examine your nails under optimal natural daylight conditions, ideally positioned near a window. If the coloration near the base of your nail bed consistently appears bluish or purplish, and this discoloration persists even after your hands have warmed up to a comfortable temperature, this observation warrants immediate discussion with your healthcare provider. Specifically, it would be prudent to inquire whether an echocardiogram might be a suitable diagnostic step, given your age and any other relevant risk factors for cardiovascular disease. Furthermore, and of paramount importance, if you ever observe a bluish discoloration on your lips or tongue in conjunction with the changes in your nails, do not delay seeking medical attention. This combination of symptoms constitutes a genuine medical emergency requiring immediate assessment. A prompt visit to an emergency department or urgent care facility is imperative. If you are interested in a comprehensive deep dive video specifically on heart failure warning signs that can be recognized at home, type the word "heart" in the comments section. All comments are meticulously reviewed, and the topics generating the most engagement are prioritized for future content creation. The second significant nail sign to be aware of is the presence of brittle, slow-growing nails. This particular sign is frequently and mistakenly dismissed by almost everyone over the age of 60 as merely an inevitable aspect of the aging process. What this refers to are nails that exhibit a tendency to break with ease, peel away in distinct layers, or split vertically along their length. Alternatively, it can manifest as nails that simply do not appear to grow at the rate they once did. Perhaps you recall a time when regular trimming every 2 weeks was necessary to maintain them. Now, it seems as though they barely change from 1 month to the next. The underlying biological explanation for this phenomenon is that the nail matrix, the crucial engine of nail growth, is not receiving the consistent and ample supply of vital nutrients and oxygen-rich blood it requires to effectively produce healthy, robust new nail tissue. In older adults, one of the most prevalent and concerning reasons for this compromised supply is a condition known as peripheral artery disease, commonly abbreviated as PAD. Peripheral artery disease is a condition that arises when the arteries responsible for transporting blood to your extremities, your arms, legs, and hands, become progressively narrowed due to the insidious buildup of plaque within their inner walls. Herein lies a critical piece of information that most individuals are never fully informed about. The very same type of atherosclerotic plaque that accumulates in the arteries of the heart, leading to heart attacks, and the identical plaque that forms in the arteries supplying the brain, resulting in strokes, is the same kind of plaque that can build up within the arteries, extending to your very fingertips. This interconnectedness is profoundly significant. The presence of plaque in one artery system serves as a powerful indicator that plaque is highly likely to be forming or already present in other arterial beds throughout the body. This is precisely why a diagnosis of peripheral artery disease is considered one of the most potent and reliable predictors of future cardiovascular events, specifically future heart attacks and strokes. Individuals who have been diagnosed with PAD face a significantly elevated risk of experiencing major cardiovascular incidents compared to those without the condition. And what surprises many people is the often silent nature of PAD. It can frequently remain asymptomatic or cause very subtle symptoms for many years before any dramatic or debilitating event suddenly occurs. However, there is a distinct pattern of warning signs that, when observed in combination, collectively signal the potential presence of PAD. Recognizing this particular confluence of symptoms is far more diagnostically valuable than focusing on any single sign in isolation. This characteristic pattern typically includes nails that are noticeably brittle and exhibit markedly slow growth, hands and feet that consistently feel cold to the touch and require an extended period to warm up, and critically, a sensation of cramping, aching, or unusual heaviness in the legs, specifically when walking, especially uphill or climbing stairs, a discomfort that reliably subsides and resolves with rest. This final symptom possesses a specific clinical designation, claudication. Claudication is regarded by medical professionals as one of the most dependable and significant indicators of substantial arterial narrowing in the lower extremities. If you find yourself experiencing all three of these signs concurrently, brittle nails, persistently cold extremities, and leg cramping or heaviness that occurs with walking and improves with rest, this specific combination genuinely warrants a serious discussion and thorough evaluation by your doctor. To further illustrate this vital pattern, let's consider a composite patient narrative involving Eleanor, a woman from Burlington, Vermont, who had dedicated her entire adult life to her passion for gardening. As Eleanor entered her late 60s, she began to notice her nails becoming increasingly brittle and prone to splitting with ease. She, understandably, attributed these changes to years of working diligently with her hands in the soil and to the often harsh, dry Vermont winters. In an attempt to alleviate the problem, she experimented with various nutritional supplements and purchased numerous nail-strengthening treatments from the local drugstore, yet nothing seemed to yield any lasting improvement. The pivotal change that prompted her doctor to investigate more thoroughly was a detail Eleanor mentioned almost as an afterthought during a routine visit. She remarked that her legs had begun to feel unusually heavy when she walked uphill, a sensation that had been gradually worsening over the preceding 18 months. Her perceptive doctor, connecting these seemingly disparate observations, performed a simple yet highly effective test. Known as an ankle brachial index, or ABI, this non-invasive test compares the blood pressure measured at the ankle to the blood pressure measured at the arm. The results conclusively confirmed a diagnosis of moderate peripheral artery disease. Armed with this crucial information, Eleanor, with her doctor's guidance, implemented aggressive lifestyle modifications, including a structured walking program, and commenced appropriate medications. These concerted efforts dramatically reduced her cardiovascular risk, effectively preventing potential future complications. Her brittle nails, initially dismissed as a minor nuisance of aging, were, in retrospect, the earliest observable sign, quietly conveying the narrative of her underlying arterial health for nearly 2 years before the condition was finally identified and addressed. The practical imperative stemming from this discussion is crystal clear. If you have observed that your nails have become distinctly more brittle, flaky, or slow-growing over the past 1 to 2 years, and concurrently experience any sensation of unusual heaviness, cramping, or fatigue in your legs while walking, particularly when ascending inclines or stairs, it is highly advisable to specifically request an ABI test from your doctor. This test is straightforward, entirely non-invasive, and remarkably effective at detecting peripheral artery disease at a stage where timely intervention can make an enormous, life-altering difference in preventing serious cardiovascular events. Now, let us turn our attention to the third sign, which was introduced at the very outset of this discussion. This is the one Dr. Walker most strongly encourages you to perform actively and immediately with him. Number 3 is known as the capillary refill test, and it can be executed on yourself in a remarkably short span of less than 5 seconds. Here is the precise methodology for conducting this simple yet informative assessment. Begin by holding your hand comfortably at the level of your heart. Select any fingernail for the test. The index finger typically works quite well. Using the thumb of your opposite hand, press down firmly but gently on the chosen nail for approximately 2 seconds. As you apply pressure, you will observe the nail bed momentarily turning white as the blood is temporarily displaced from the minuscule capillaries situated directly underneath. Now, release the pressure and immediately begin counting, using the 1001-1002 cadence to accurately gauge the elapsed time. Pay close attention to how quickly the normal, healthy pink color returns to the nail bed. In a healthy adult with robust and efficient circulation, that characteristic pink coloration should return in less than 2 seconds. If, however, it consistently takes 3 seconds or longer for the color to return, especially if this prolonged refill time is observed repeatedly across multiple fingers, this constitutes a significant indicator that the smallest blood vessels within your body are not refilling with blood at a normal, healthy pace. Complementing the capillary refill test, there is an additional, equally simple test that healthcare professionals often find beneficial when assessing peripheral circulation. Gently press the back of your hand against your forehead or your cheek. In ideal circumstances, your hand should feel approximately the same temperature as your face. If your hands consistently feel noticeably cooler than the rest of your body, even when you are in a warm room, this serves as another valuable marker, suggesting reduced peripheral circulation. Performing both of these tests in conjunction provides a much more comprehensive and nuanced picture of your circulatory health than either test can offer in isolation. Biologically, the capillary refill test provides a direct measure of the speed at which your microvascular system, the intricate network comprising the tiniest blood vessels throughout your body, recovers from momentary external pressure. A sluggish or slow capillary refill time fundamentally indicates that the circulation within these small vital vessels is compromised or sluggish. Medical research has established clear links between persistently slow capillary refill times in adults over the age of 60 and a range of serious cardiovascular concerns. These include reduced cardiac output, the amount of blood the heart pumps per minute, undiagnosed atrial fibrillation, a common heart rhythm disorder, and an elevated risk of stroke. The microvascular system, precisely because its vessels are so small and have inherently less compensatory reserve than larger arteries, is often the very first site where nascent cardiovascular trouble makes its presence known. An important caveat must be noted before any undue alarm. If your capillary refill time is borderline, perhaps around 2 to 3 seconds, this alone is generally not an immediate cause for panic. This is especially true if your hands are cold at the time of the test or if you are currently taking certain medications. For instance, some blood pressure medications and beta blockers can subtly slow capillary refill without necessarily indicating any underlying pathology. Therefore, it is advisable to repeat the test in a warm room, ensuring your hands are comfortably warm. If, even under these optimal conditions, the refill consistently takes 3 seconds or longer across multiple fingers, that is when the finding becomes clinically meaningful and warrants further attention. The profound significance of the capillary refill test lies in its ability to provide you with immediate, actionable information, utilizing nothing more than your own hands. There is no need for a doctor's appointment, no specialized equipment, and no complex procedures. All that is required is approximately 5 seconds of your time and adequate lighting. Consider the composite scenario of Walter, a retired postal worker from Topeka, Kansas, which vividly illustrates the immense value of this simple test. Walter, after watching a similar health tip on a daytime television program, decided one evening to try the capillary refill test on himself. To his surprise and growing concern, he counted nearly 5 seconds before the normal pink color returned to his index finger. Intrigued and a little worried, he repeated the test on his thumb, then his middle finger, and then on fingers of his other hand. The result was consistently the same, a noticeably prolonged refill time. The very next morning, he contacted his doctor's office, articulating his observations clearly. His doctor, recognizing the potential significance, asked him to come in for an urgent appointment. Following a comprehensive cardiovascular workup, it was discovered that Walter had previously undiagnosed atrial fibrillation, a prevalent heart rhythm disorder that constitutes one of the leading risk factors for stroke in older adults. Walter was promptly initiated on appropriate anticoagulation therapy, a treatment regimen that, according to current cardiology literature, very likely prevented a major stroke within the subsequent 12 months. The practical and immediate takeaway here is to actually perform the test. Do it right now before you conclude watching or reading this information. Conduct the capillary refill test on at least 3 different fingers. Ensure you perform it in a warm room with warm hands to eliminate the confounding variable of cold temperature potentially affecting the result. If your capillary refill consistently takes 3 seconds or longer across multiple fingers, make a written note of this observation and make sure to bring it up during your very next medical appointment. Specifically, inquire whether a comprehensive cardiovascular evaluation, potentially including an electrocardiogram, EKG, and possibly an echocardiogram, would be an appropriate course of action given your findings. We encourage you to share your results. Tell us in the comments section right now how many seconds your capillary refill took. Every reply is meticulously read and valued. Before we delve into the fourth and final sign, the one almost nobody knows about, if this discussion has proven helpful and insightful thus far, a quick thumbs up genuinely makes a significant difference in helping this information reach a wider audience who could greatly benefit from it. Finally, we arrive at the fourth and arguably most overlooked sign, one that has been deliberately saved for last due to its unique significance. Number 4 involves subtle changes to the lunula, a term that most people reading or hearing this have likely never encountered in their lives. Direct your gaze to the very base of your nail, precisely at the bottom, situated just above your cuticle. Can you discern a small, distinct, whitish crescent shape, almost resembling a miniature half-moon? This distinctive structure is your lunula. Biologically, the lunula represents the visible portion of your nail matrix, the very engine room where new nail tissue is continuously being formed in real time. Despite its fundamental role in visibility, the lunula remains one of the most consistently overlooked diagnostic signals within the entire human body. Here is a crucial piece of information about the lunula that most individuals are never informed about. The pattern of which fingers possess visible lunulas holds as much diagnostic importance as their mere presence or absence. In a healthy adult, it is almost universally expected that the thumb and the index finger will exhibit a clearly visible lunula. The middle finger typically also presents with one. The ring finger sometimes does, and it is entirely common and considered completely normal for the pinky finger to lack a visible lunula altogether. Therefore, if your pinky finger does not display a visible lunula, but your other fingers do, this observation should not be a cause for concern. What is concerning, however, is when this established pattern undergoes a noticeable change. This includes instances where lunulas that were previously clearly visible on your thumb and index finger have inexplicably disappeared, or when the lunulas across all your fingers have become markedly diminished in size, barely visible, or have completely faded. Critically, changes in the color of your lunula are particularly telling, with each distinct color shift pointing towards different potential underlying health concerns. A lunula that has taken on a reddish hue, for example, has been associated in some clinical research with conditions such as congestive heart failure and certain rheumatic conditions that have an impact on the heart. Conversely, a bluish tint to the lunula can strongly suggest the same underlying oxygenation and circulation problems that we discussed earlier in the context of cyanosis, indicating a potential deficiency in oxygenated blood supply. Furthermore, a very pale lunula, one that appears to have almost faded seamlessly into the rest of the nail bed, can be a significant indicator of anemia. Anemia, a condition characterized by a deficiency in red blood cells or hemoglobin, carries its own substantial and well-documented connection to increased cardiovascular strain, as the heart has to work harder to deliver oxygen throughout the body. The reason the lunula earns this final, prominent position in our discussion today is precisely because it is a diagnostic signal that almost no one is educated to examine, yet it stands as one of the most readily accessible and visible indicators your body provides. The vast majority of people have never been instructed to inspect the base of their nails for anything beyond signs of infection or trauma. Consequently, a subtle yet potentially life-saving sign, one that could prompt a crucial conversation with their doctor, often goes entirely unnoticed for years, leaving serious conditions to progress silently. Let's consider a particularly instructive composite case involving Dorothy, a 72-year-old grandmother residing in Asheville, North Carolina. Dorothy had enjoyed robust health for the majority of her life. During a casual phone conversation with her daughter, who happened to be a nurse, Dorothy mentioned, almost as a jest, that the little white half-moons on her fingernails seemed to have vanished. She genuinely couldn't even recall when she had last seen them. Her perceptive daughter, recognizing the potential significance of this seemingly minor observation, gently but firmly encouraged her mother to bring it up at her next physical examination. Dorothy did so, albeit somewhat reluctantly, feeling a bit silly mentioning her fingernails to her doctor. To Dorothy's surprise and relief, her doctor took the observation with utmost seriousness, ordering a complete blood count and a comprehensive cardiovascular risk assessment. The blood work subsequently revealed significant anemia that had been quietly developing over time. Concurrently, the cardiovascular workup uncovered early signs of strain on her heart. Crucially, both conditions were identified and addressed effectively before they had an opportunity to progress to a point that would have precipitated a major, potentially life-threatening event. The change in Dorothy's lunulas was the very first observable sign, a silent harbinger that could have easily been missed for another 2 or 3 years if her daughter had not encouraged her to voice her seemingly trivial observation. The practical conclusion and immediate action point regarding the lunula are simple and clear. Take a moment right now to carefully examine your thumbs and index fingers under good, natural lighting conditions. Observe the base of each nail for the presence and appearance of your lunulas. If your lunulas are entirely absent across most of your fingers, if they appear to have noticeably shrunk in size over recent years, or if their color has undergone any noticeable change from the normal pale white, these are observations that absolutely warrant discussion at your next medical appointment. Specifically, request a complete blood count and a comprehensive cardiovascular risk assessment from your healthcare provider. Now that all 4 vital nail signs have been thoroughly covered, let us Integrate this knowledge into a practical framework for actionable steps. Acquiring information and actively applying it are two distinct processes, and the aim here is to bridge that gap for you, empowering you to take proactive control of your health. Begin your journey of self-monitoring today with a remarkably simple yet powerful exercise. Find a location near a window with abundant natural daylight. Take both of your hands and meticulously examine each nail. Pay close attention to the overall color of the nail bed, noting any subtle or pronounced bluish or purplish tint. Observe whether your nails feel unusually brittle, thin, or appear to be growing at a significantly slower pace than they once did. Next, perform the capillary refill test on a minimum of 3 different fingers, carefully timing the return of color. Finally, inspect the base of each nail for the presence of the lunula, noting which fingers clearly display this crescent shape and which do not. As an invaluable aid, consider taking a clear photograph of both hands. Maintaining a visual record over time is profoundly useful, as gradual changes can be exceedingly difficult to recall accurately from memory alone. This week, if any of the specific nail signs and associated patterns discussed today resonate with what you observe on your own hands, take a moment to record your findings. Note the specific sign you identified, which finger or fingers exhibited it, and your best estimate of how long you have noticed this change. Bring this detailed written note with you to your very next doctor's appointment. Within the next 30 days, if you observed 2 or more of these concerning signs appearing together on your hands, do not passively wait for your annual physical examination. Take proactive initiative. Call your doctor's office, clearly describe what you have observed, and ask whether a nurse can conduct a quick phone triage. This brief conversation can help you and your healthcare team determine whether you need to be seen sooner than your scheduled appointment. And most importantly, it is crucial to reiterate, please do not attempt to self-diagnose based on any single sign in isolation. While these signs offer valuable clues, they are precisely that, clues. What truly matters is the comprehensive clinical picture, which encompasses your complete medical history, your current medications, any other symptoms you might be experiencing, and, crucially, the findings from your doctor's professional examination and diagnostic tests. The fundamental purpose of today's detailed discussion is to empower you to become a more informed, engaged, and proactive participant in your healthcare conversations, not to replace the essential role of professional medical advice and diagnosis. In closing, this is the profound message to carry forward. Your body has been in constant communication with you throughout your entire life. It has been tirelessly sending you a myriad of signals, some overt and others subtle, every single day. The truly remarkable aspect of navigating life beyond the age of 60 is that you now possess a wealth of context, a rich tapestry of lived experience, and greater access to sophisticated medical support than at any prior stage of your life. The decades of your 60s, 70s, and beyond are emphatically not a period when meaningful health changes become an impossibility or when proactive intervention is futile. On the contrary, extensive medical research consistently demonstrates that early detection of potential issues and an informed, attentive response to these kinds of bodily signals can dramatically and positively alter health outcomes, even in the later chapters of life. The nails you casually glanced at this morning, and perhaps dismissed as utterly uninteresting, may, in fact, represent one of the most accessible and powerful diagnostic windows your body has graciously afforded you. You simply needed to acquire the knowledge of how to interpret their silent language, and now you possess precisely that understanding. If you have found this information helpful and empowering, please thoughtfully consider subscribing to this channel. Doing so is genuinely the most effective way to ensure you remain updated and do not miss valuable future content. Furthermore, if you can think of someone in your life whom you deeply care about, a spouse, a sibling, a cherished friend, who could profoundly benefit from recognizing these 4 vital nail signs, please take the initiative to share this video with them. The next person you forward this invaluable knowledge to may very well be the one who, tonight, finally notices something significant on their own hands, initiating a journey toward better health and potentially preventing a serious illness. I look forward to connecting with you in the next video.